And on the line with me, I am pleased to have Mayor Adam O'Neill. He is the white Southern conservative Republican mayor of Belhaven, North Carolina. The website saveourhospital.org. And Mayor O'Neill, welcome to the program.
Tom, nice to be with you. I actually have Bob Zellner with me, who's been on your show before, a civil rights legend. He's with me.
Oh, great. Great. The two of you together. I mean, so
he's walking with me, and he's 75, and I can barely keep up with him.
So what brings a civil rights icon and a white conservative Republican mayor together?
Health care. I think it's something that Republicans and Democrats, all of us, can work together on. And I hope that through our walk and through our efforts over the next few weeks, we can get Republicans and Democrats to see this health care issue with rural hospitals has to be solved, and it's going to take everybody working together.
Okay, so you are a mayor of a small town in rural North Carolina, and because Pat McCrory and the Republican legislature of North Carolina has decided not to take Medicare expansion money from the federal government, your local hospital went out of business, I understand. In fact, I understand a 48-year-old woman died as a result of this.
That is part of it. North Carolina has turned down Medicaid expansion, which has taken $2 billion out of our health care system, which has an effect. $2 billion has an effect. And but in our situation, we also have a big health care conglomerate that came in and bought our hospital, or basically took it over. Didn't buy it, took it over with $1 million more assets and liabilities. And this nonprofit healthcare conglomerate, who made $109 million in 2013, decided to close our critical access hospital that lost $1 million.
Wow.
So we weren't even the hospital that lost the most money. We were a third or fourth as far as that goes with their 9 hospitals. But this critical access hospital that was put there by the Hill-Burton Act, Republicans and Democrats coming together, Biden Health decided to close our hospital after a year where they, as a nonprofit, made $109 million.
So you're not only dealing with the lack of funding because Medicaid expansion is not being taken by North Carolina, but you're also dealing with a corporate monolith. With one, these are the problems that came out of in 1982. Basically, Ronald Reagan decided to no longer enforce the Sherman Antitrust Act, and the consequence of that was a decade of mergers and acquisitions and all this M&A frenzy. And now we've got these giant corporations that are big enough to back down governments. I mean, they're backing you down, apparently.
They have terrific political influence, and we're feeling it. These guys, once again, now listen to this. They've got $550 million in the bank in reserves. They made $127 million in 2012. They made $109 in 2013, and are closing a critical access hospital, which means people are having to spend another half an hour on an ambulance to get emergency care. We just had a lady die last week, a week ago. We just had a lady die of a heart attack waiting for a helicopter for an hour. In 30 minutes, she could have been at the hands of an emergency room physician with all the tools, all the medicines that they would have. Instead, Biden closed our critical access hospital, and that lady didn't have as good a chance, and she died as the helicopter was landing. That's why I'm walking, because people are dying. And it's not just Belhaven, it's across this country. More rural hospitals have closed in the last year than the last 15 years. And people need to know this, and we've got to stop this trend.
Right. So we're talking with Mayor Adam O'Neill. He's the Republican mayor of Belhaven, North Carolina. He is marching from Belhaven to Washington, D.C., and in fact, when he gets to D.C., he's going to be on our program as well. SaveOurHospital.org is the website about that march. His Twitter is Mayor O'Neill, O-N-E-A-L. And this 2-week journey started on July 14th, started on day before yesterday. It's a 350-mile walk to Washington, D.C. This is damn hot weather to be, although today we got a little bit of a break, I guess. But
it's
wow.
273 miles, 540,000 steps, Tom.
Wow. You've calculated that very carefully.
Yes, we have. Bob Zellner, I'm going to start calling him Lightning. He's out in front of me. I'm chasing him the whole way. He's 75 years old. It's incredible.
It's great. So the two issues, you want to talk to Attorney General Holder about these large hospital corporations.
Well, Tom, we have a Title VI complaint that's been filed against Vidant. NAACP has filed the complaint.
Title 6 being the anti-discrimination laws.
Effect taking place against African Americans, Latinos, and poor people with this action that Vidant is taking. Vidant, you know, the way they made $109 million is due to all the federal money they got. And they can't be taking all that money. This nonprofit can't be making all that money and then basically discriminating services against a certain group of people.
Right.
The Title VI complaint is in place, and HHS is now investigating Vidant Health. So I want to go talk to Attorney General Eric Holder and give him our side of the story from a real perspective of talking to real people. I've got a picture with me of Portia Gibbs, the lady who passed away, and I think we need to put a face with this issue.
Yeah. Any idea how much the CEO and the senior executives of Vidant Health are making?
There are several executives at Vidant Health that make more money than Belhaven was losing, than our hospital was losing. Wow. They were running our hospital with a manager working a half a day a week. A half a day a week. We have had a business plan done that shows our hospital can not only break even but succeed and be successful with part of the Affordable Care Act called an ACO, Accountable Care Organization. Right. This is where the government gives you incentives to help them save money with Medicare. So we've put together a model, the Belhaven model now, where we can show you how to make one of these small hospitals go. The problem is Vidant Health doesn't want us to be successful. We went through mediation with them. They played games with us, started saying things weren't assets that were assets, delaying information to us, and on, trying to keep us from being successful. Our community wants a fair shot at taking our hospital back. And for a big medical conglomerate to come in, take our hospital, and take something that saves lives and not give the community the full chance to take it back is just wrong, and it's immoral, and we've got a greedy nonprofit here. And the CEO, David Herman of Vidant Health, makes about $2 million a year. He makes about twice what our hospital lost. Wow. Now, I don't think one man's compensation is worth more than 20,000 people's health care.
Right.
That's just me.
Or this one woman's life. Over at the Community Environmental Legal Defense Fund, CELDEF, they have been helping communities like yours, mostly small towns, mostly in coal country or where they're trying to cite pig farms or things like this, usually around environmental issues. But these towns are passing laws saying, we don't recognize this corporation as having the rights of a human being, and the rights of our human beings are more important than this corporation. They pass these through the city councils, and they're litigating these things, and sometimes with some success. Are you familiar with Tom Lindsay and CELDEF?
I am not, and I would like to be. If you'll give him my number,
I will, and I'll get his information to you as well, because this is another path that you could take if you've got a city council that will go along with you on passing.
We do. We have a city council that's on board. We need to save lives. We need to keep our emergency room.
Yeah, because this is one way to take on a
hospital, critical access hospital.
Yeah, this is one way to take on a rogue corporation. I mean, it takes a lot of effort, but we got to do this 16 ways to Sunday here. It's because these giant corporations are just coming at us and they call themselves nonprofits, and then they pay their CEO $2 million a year. Say what?
It's ridiculous. There should be laws. The IRS should have an interest in Vidant Health making $109 million over expenses, making $109 million of profit, and closing down a government classified critical access hospital.
Right.
While they also have $550 million to bank.
And then doing everything they can to prevent a public entity like your town from, quote, competing with them. Mayor Adam O'Neill, you're a good mayor. You're a good man. I thank you very much for being with us.
Thank you, Tom.
And I look forward to talking to you when you get to D.C. The website, again, saveourhospital.org. Republican Mayor Adam O'Neill. We'll be back.